Today we're talking about health insurance, everyone's absolute favorite topic of conversation, because it's great. I'm only going to talk about positive things today, about how great our health insurance system is in the United States, how I love medical care and medical issues, and how clients just flock to me with all of their positive health insurance questions, stories, and topics. Hi, welcome to It Doesn't Have to Be Terrible, a podcast with me, Caroline Snyder, where we explore the stories, topics, and questions that help us as individuals better understand how we impact and are impacted by the financial world around us. Welcome. So I want to ground us and ground this conversation in a few statistics that I think are really helpful for understanding the context of what and who we're talking about when we're talking about health insurance in the United States. So all of the statistics I'm going to talk about and share are from the most recent census. So these are all 2022 numbers. They're probably just about the same. I'm sure there's slight differences, but there's been no major push one way or the other. So that being said, as of 2022, 8.4% of Americans are uninsured, meaning they don't have health insurance of any kind. 8.4%. Quite frankly, when I looked at that number to start, I was like, that's not that high, and it has gone down over time, which is good. But it's over 27 million people. That's a lot of people when you start thinking about that 8.4% as individual human beings. 27 million people is a whole lot of people who, if something were to go wrong with their health, they're basically up poo-poo creek without a paddle, right? And then we start talking about the people who are insured. So of the folks who are insured, 54.5% had employer-based insurance. So where you have a job, and through your job, you are able to sign up for group health insurance, and you probably pay a portion of your monthly premium. It used to be slightly more common that you wouldn't have to pay anything. That's not the case anymore. So over half of people who are insured through their jobs, which means that if you lose a job, you also lose insurance. We'll talk about that soon. Okay, and then there's kind of three chunks of people who get health insurance through the government. So Medicare, Medicaid, and then TRICARE, which is for active duty service members, and the VA has its own system too for veterans, and I cannot remember the name of the VA one right now. Maybe it actually is part of TRICARE, whatever. So about 18% of folks who are insured through Medicare, about 18% are insured through Medicaid, and then about 3.5% are insured through veterans, through the VA or through active duty service systems. So that's the government piece of the puzzle. The rest of the folks, it ends up being about 10%, have direct health insurance, meaning they're buying on the marketplace, they're buying directly from the insurance companies. And for those of you who are really arithmetically savvy, you may just realize that the numbers I just put are over 100%. So that 54.5, the 18.8, 18.7, 3.4, and then 10% is actually about 105% total. The reason is that in this group of people who are insured, because so much of that insurance is through employer-based insurance, employer-based group health insurance, when people lose jobs or change jobs or leave jobs or retire or whatever it may be, there's gaps in the system. So that over 100% is taking into account that some folks might be counted in employer-based and in Medicare at the same time for a piece of the puzzle. So that's the system, right? We have this very disjointed kind of puzzle piece put together system of health insurance in this country where a good chunk of people get their health insurance through work, a good chunk of people get their health insurance through the government, and then there's a good chunk of people who do it directly. And what I mostly want to spend the time today talking about is that last chunk, that like when you're having to get insurance directly, and this in between when you have it based from your employer, but maybe you won't anymore, or you'd like to leave your job. There's this muddy middle that's there. This messy middle, this direct, this what do I do in between world. Because I think that's where the most people, I don't even know if this is true. That's where a lot of people fall through the cracks, and that's where a lot of things go awry. And that's what I'm most interested in, is when things go awry. I don't have a positive spin on that. I think it would also be really helpful. So if we've grounded ourselves in the statistics, right? We know about how many people are uninsured. We know about how many people have insurance through these different buckets. I want to also ground us in a couple definitions that I know from experience personally, and I know from lots and lots of experience with clients that can really throw people off. So we're going to define a few key terms. Premium. Whenever we're talking about health insurance premiums, we're talking about the monthly cost of having health insurance. For folks who have health insurance through their employer, a portion of their premium might be paid for by their employer. So someone who's like, oh, I pay $200 a month for insurance through my job. They pay $200 a month. Probably their employer pays something as well. The premium might be something that is totally paid by you. Certainly if you have direct health insurance, that premium is totally paid by you. You might have some sort of subsidy that makes it a little bit cheaper, but you're the one who's in charge of paying that premium. So that's the monthly cost. Okay, so a deductible. That's how much you need to pay before insurance will start paying for a portion of your health costs. And they don't pay for everything. It's what's called co-insurance. So they pay for a percentage. So if you're shopping around and looking for health insurance, it's important that you know what the premium is, how much you're going to be on the hook to pay every month. It's important that you know what the deductible is, how much you have to be able to pay before co-insurance kicks in. And then you want to know what the co-insurance is, because that's the percent that health insurance company is going to pay. Maybe it's 50%, maybe it's 70%, maybe it's 30%, but that is after you've hit your deductible, the percent of the costs that you are going to have to pay versus the percent of the costs that the health insurance company is going to pay. And then there's what's called the out-of-pocket max, which I, in my mind, and sometimes verbally out loud, think of as the oop max, because that's a way to make it feel less depressing. So the oop max is the out-of-pocket max. That is the maximum amount in a year that you are going to need to pay for your health insurance costs. So if, poop hit the fan over and over and over and over again, you're not going to need to go past your oop max, your out-of-pocket max. There's a couple things that often trip people up. One, copays don't typically count towards your deductible or your out-of-pocket max, which is confusing because you feel like you've spent money because you have, but they have loopholes because that's how they make oodles of money. in-network versus out-of-network. There are different systems for in-network costs, for out-of-network costs. So you often have an in-network deductible versus an out-of-network deductible, and you need to pay attention to both. Ugh. Individual versus family out-of-pocket max. So if you have dependents on your health insurance plan, just because you hit your individual out-of-pocket max doesn't mean you've hit your family out-of-pocket max, which means you are likely to continue to pay more money towards your medical bills. Basically, think about it as any time a health insurance company has the opportunity to make money by creating a loophole to make it be less good for you, they've done it without fail. I mean, like, the loopholes upon loopholes upon loopholes are incredible. And that's just with the plans themselves. That doesn't count, it doesn't even get into the individual health needs that then get coded by a doctor's office, by people in your doctor's office, and then get sent to the health insurance company to determine how much they cover, right? There is this very, very opaque system of determining between doctors' offices and hospitals and health insurance companies and pharmacies and the government to determine what is and what is not covered and in what way it is covered. And while there is more transparency now than there was 5 years ago, or certainly 10 years ago, there is still very little transparency and it's very confusing. So if you are listening to this or watching this and seeing my beautiful face, and you're like, I just don't get it. I'm so confused. I don't understand the bills. It's not you. It is the system. The system is designed to be confusing. The system is not designed to make sure that you as an individual patient and as an individual human being have all of the care that you need. It is designed to be a profit maximizing system for the companies in charge. Health insurance and medical bills are like deeply important to me as an individual human being. I have no idea how much time I have spent arguing with medical related entities about bills. I will tell 2 stories, maybe 7. I'll tell 47 stories. I'm going to tell 200 stories. No, I'm going to tell a couple stories. First story. When I was getting my MBA, I worked in Houston as an MBA intern over the summer in between my first and second year of grad school. And I really liked the job that I had. I really loved the boss that I had. She was like just a wonderful, wonderful human being and a great mentor. And I think this was week 1, maybe week 2 of the internship. I was brought on a business trip to Oklahoma. We flew from Houston to Oklahoma. And the first night we arrived, I was like feeling kind of jittery. I think I was feeling a lot of nerves about like imposter syndrome. I've been here for a week and now I'm on this trip and it all feels really weird. And also, what is Oklahoma? What's happening? And so I decided that I was going to go on the treadmill at the Hotel Gem for like 20 minutes. And I was like, I'm just going to go get some of these like wiggles out. I'm sure I didn't think that at the time. That was so a mom of toddlers, just speaking. But I was going to go get my wiggles out on the treadmill. And I go down, get on the treadmill. I don't know what happened. I was on the treadmill and I guess I blacked out. I mean, I have no clue. I was in the hotel gym by myself. I remember running, and then I remember being in the hotel lobby, which was not close to the gym. Like, I have no clue how I got from the gym to the lobby. I remember being in the lobby, bleeding, sitting on this couch, and being just like extraordinarily confused as to what was going on. I don't even know, like, I think I sent my boss at the time a very like weird text. I think I said something about my mother who was dead in the text. My boss knew my mother was dead. Anyway, she came and found me, thank goodness. And then my two coworkers, who I'd known for all of 3 seconds, took me to the ER in Oklahoma City. I think, I don't remember where I was. And then they stayed with me for the next like 6 hours while I was in the ER getting like every test known to man done. They thought I was having seizures. I mean, like, I had a CAT scan, I had everything done, and they could not find anything. And to this day, I have no idea what happened. No clue. I do know that I was incredibly polite to all the people. I think I was just like so embarrassed. I remember having this conversation with the guy who was doing my CAT scan about my running shoes and being like, they're so great. And eventually I'm like, you just fell on your head on a treadmill. And you're telling a stranger, like, you should buy these shoes. They're really good. They're not going to give you a concussion. It's fine. Anyway, I had my health insurance card with me. I gave my health insurance card to the ER. They ran my health insurance card. As far as I knew, everything was fine. I left the ER. I made it through the internship. And maybe like 6 weeks later, I started getting bills for tens of thousands of dollars. And they were saying that I didn't have any health insurance. I was like, what the heck? I did have health insurance. I filled out all the paperwork. Also, like, why are you having people fill out paperwork who clearly have a concussion and maybe just had a bunch of seizures? Like, that is an asinine system just to think, like, to start with. Like, the likelihood of me having misspelled something or getting a number wrong or whatever is high and not my fault. Anyway, I dealt with that system. I had a recurring calendar reminder to call and yell at these people. I dealt with that for years. I graduated grad school. I worked a job right after grad school. I left said job. I started this company, Verity Advising, and I still had not finished dealing with them. They eventually sent it to collections. I fought. I got lawyers to write me letters. And then one day, they just stopped calling and they stopped bothering me. But I had meticulous notes with everyone's name, who I spoke to, how long I spoke to them, what time of day it was, what day it was, what reference number they had. I mean, they should have paid me. And also, the amount of time, the hours upon hours upon hours I spent fighting those bills, which I was happy to pay once they ran it through insurance, right? Like, had they just run it through insurance and they're like, okay, Caroline, you owe $1,800 or whatever it was going to be, I would have happily paid. I mean, maybe not happily, but I would have paid. I wasn't trying to not pay. I was trying to pay what I was actually owed. Anyway, that was like a part-time job for several years. That's one story. Another story. My husband has Crohn's disease, which I think of as like very managed. But when he was in grad school, he ended up having a pretty bad flare, and similarly to me in my story, went to the ER. Not similarly, his health insurance did go through. He ended up staying there. Were we there overnight? One night. Okay, one night, but no pain meds. He got an IV with fluid, just like to hydrate. He was being monitored. Was there imaging done? I think they did an x-ray. It was like the least amount of intervention. He was saying no to basically all of the intervention options that were not absolutely necessary. So like no pain meds, no, I guess it was mostly pain meds, but like he was really holding steady on like, I don't want to do anything above and beyond what is absolutely necessary for me in this moment. That bill, when it arrived, without, like, if they sent the bill, they showed the number pre-insurance, it was over $50,000, right? Did you think it was 45? Oh no, I think it was 45. It was $45,000 for one night. That is more money than I had ever made in a year as a high school teacher. Like his not even 24 hours in a hospital where the only intervention he got was maybe one image done and some fluid IV, like hydration, costs more than what I was paid to teach 120 kids for a year? Like, there's no way that's true. That is just not true. So if we start from this place of like absurd price inflation, of course it's broken. Like, another personal story. Currently, my family has small group health insurance through my company. So it covers me, my husband, and our 2 kids. And we spend over $1,600 a month on the premium alone. It's a nice plan, but it's not like the fanciest plan of all time. It covers the doctors who we need it to cover. Granted, we have like some specific needs. We're not a family of like no medical needs, but really in the grand scheme of things, we're also not a like super high needs family. Over $1,600 a month in premiums. But of course we're paying over $1,600 a month in premiums if the prices, that inputs that then the health insurance companies use to spit out the numbers that are the prices, if those inputs are those inflated asinine inputs like the $45,000 overnight stay, of course we're stuck paying these absurdly high prices. And I don't know, I have no clue how to fix the problem. I have some ideas, but I don't pretend to be an expert on how to untangle this web. What I do know is that the people who are being screwed are individual human beings who are not understanding the system for no fault of their own. They're not understanding the system because it is a bonkers system that is meant to trip you up and meant to be confusing. And then even if they're trying to do everything right, they're getting bowled over by these massively huge companies that don't see you as an individual. I think about this all the time with the Oklahoma story. Like, I was in grad school and had a flexible schedule. And then I happened to be in a career path where I had a flexible schedule. Had I still been a high school teacher, I would have physically, if I'd still been a high school teacher, I would have physically not been able to make the phone calls that I made that eventually got that issue taken care of, right? I would not have been available to make a phone call during the windows that the stupid companies were open for me to go argue with them. And so I benefited from the fact that it was really just a roll of the dice that I was able to do that. Like, you shouldn't have to have a flexible schedule and spend 100 hours. I bet it was 100 hours. I mean, I have no idea. I don't want to think about it. I haven't thought about this in a while, and now I'm kind of upset. I feel a little nauseous. You shouldn't have to rely on the roll of a dice to be able to fight something that someone else has screwed up. That shouldn't be the system that we have. So while I don't know how to untangle it, and I don't know exactly what the perfect solution is, I do know that the solution that we have right now is poop. And I know that in a country with both federal and state governments that claim that we're very pro-entrepreneurship and that we believe in the American dream and pulling yourself up by the bootstraps, and that we love small businesses, I know that the current health insurance system is hurting all of those people and is holding people back who don't come from family wealth from being able to take the leap to leave employer-based insurance because they don't feel able to go it alone. Because if I were working for a company, probably my family of 4, I would spend like, I don't know, maybe $500 a month instead of over $1,600 a month on health insurance premiums. That's a huge gap. Of course, people don't feel comfortable making that leap. And that's really sad. And it's not any individual person in those situations. It's not their fault. My 2 positive notes. 1, if you get a medical bill and you're like, what is this? Call and argue. Because very, very, very frequently, you can get the hospital or the doctor's office to rerun the service using a different code that then could get covered at a greater extent by insurance. Call, so that's part of the calling. Another part of the calling is if it's actually like, no, this is a totally legit bill, there's no arguing with the bill. Almost always you can get set up on an interest-free payment plan so you won't have to pay the bill all at once. If you do feel able to pay a bill all at once but not at the actual number that it is, like let's say it's an $800 bill and you're like, if it were $500, I could pay it. You should also call and tell them that, because sometimes they'll be like, cool, we'll take $500, bye. Which, Pete, by the way, that's not how businesses are supposed to work. They have built in that they assume people can't pay the bills. Then those shouldn't be the bills. Ugh. Okay, so call and argue. Be nice. If you get someone on the phone who's a total poopwad, hang up, call again. Try to get an interest-free payment plan. Ask if you can pay less amount. I know asking those questions can be uncomfortable. Just keep in mind that it is not about you. It is about you not getting screwed over and you're acting to protect yourself. And the worst case scenario, they say no, which puts you in the exact same position that you're in right now. So my positive end is not actually that positive, but it's that you have a little bit of power and you should use it. Yeah, I need to get off my soapbox. I'm now feeling upset and flustered. But if you have any questions, reach out, ask me the questions. If you're curious to learn more about health insurance and how the whole system works and figuring out what kind of coverage you personally need for health insurance and other kinds of insurance, I highly recommend you check out the Finance Friends Forever course that I did with ilovecreatives. We have a whole chapter about insurance and we get deep into the nitty-gritty. It is a great course. And if you have questions, reach out, email me, DM me, find me on social. Thank you so much for being here. I appreciate your time. I appreciate you listening. I appreciate you watching. Please like, subscribe, leave a review. It means a lot. Thank you.